Welcome to our guide on hyperthyroidism and Graves' disease. Hyperthyroidism, where the thyroid gland overproduces hormones, often manifests through symptoms like weight loss and rapid heartbeat, with Graves' disease being a common autoimmune form of this condition. Managing these disorders effectively involves not just medical treatment, but also lifestyle and dietary adjustments. In this video, we'll outline a hyperthyroid diet plan tailored to support thyroid health and address weight management, helping you navigate these challenges and enhance your well-being. What is hyperthyroidism? Hyperthyroidism is when your thyroid gland, located at the front of your neck, makes too much thyroid hormone. This hormone helps control important body functions like energy, digestion, and more. The most common cause is an autoimmune condition called Graves' disease, which affects about 1 in 200 Americans. Women are more likely to have thyroid issues, including hyperthyroidism. Symptoms of hyperthyroidism and Graves' disease. Symptoms of having too much thyroid hormone include fast or irregular heartbeat, unexpected weight loss, anxiety, frequent bowel movements, or diarrhea. Changes in menstrual cycle, muscle weakness or tremors, swelling of the thyroid gland, goiter, increased sweating or clammy skin, sexual dysfunction or reduced sex drive, eye problems like bulging eyes, dryness, or pain, thick, red skin on legs or feet. Doctors typically diagnose hyperthyroidism with a blood test to check thyroid hormone levels, a radioactive iodine uptake test. If your blood test shows low TSH, thyroid-stimulating hormone, and high free T4 levels, you likely have hyperthyroidism. Elevated thyroid antibodies like TSI, TPO, or TG may indicate Graves' disease. The radioactive iodine test helps rule out other conditions such as thyroid nodules, toxic multinodular goiter, or thyroid cancer. Be sure to talk to your doctor about potential side effects before having this test. Hyperthyroidism can be caused by 3 main factors. Graves' disease, an autoimmune disorder that causes the thyroid gland to overproduce hormones. It is the most common cause of hyperthyroidism. Thyroiditis, inflammation of the thyroid gland, which can result from viral infections, radiation, certain medications, or postpartum thyroiditis after childbirth. Thyroid nodules, abnormal growths within the thyroid gland that can lead to excessive hormone production. Managing hyperthyroidism is essential because if left untreated, it can lead to serious complications such as heart damage and a potentially life-threatening condition called a thyroid storm. Effective treatment focuses on reducing thyroid hormone levels and addressing any underlying causes to prevent these severe outcomes. Natural treatment options for hyperthyroidism and thyroid wellness. Managing hyperthyroidism involves 2 key goals: stopping the harmful effects of excess thyroid hormone and addressing the root causes to prevent recurrence. Conventional treatments such as antithyroid medications or radioactive iodine therapy can help manage symptoms but often don't address underlying autoimmunity. Natural remedies offer effective alternatives with fewer risks and may also target the underlying causes of hyperthyroidism. These include selenium, shown to reduce antibodies and symptoms of Graves' disease, as well as improve outcomes with conventional treatments. L-carnitine, an amino acid that helps alleviate symptoms like fatigue and palpitations and is safe for pregnant women with Graves' disease. Lemon balm and bugleweed, herbs that may reduce symptoms and thyroid hormone levels, with preliminary studies showing promise. Short-term iodine. Excess iodine might help control hyperthyroidism symptoms, though its effects may not be permanent. Probiotics, addressing gut health issues commonly found in thyroid patients, which may be linked to thyroid disorders. These natural options provide additional pathways to support thyroid wellness alongside conventional treatments. What is Graves' disease? Graves' disease is an autoimmune disorder where the immune system erroneously attacks the thyroid gland, causing it to become overactive. This results in hyperthyroidism, a condition where the thyroid produces excessive amounts of thyroid hormones. Located at the front of your neck, The thyroid is a butterfly-shaped gland crucial for regulating metabolism, the process through which your body converts food into energy. Named after Robert Graves, the Irish doctor who first described the disease in the 1800s, Graves's disease is the most common cause of hyperthyroidism. It often leads to symptoms such as weight loss, rapid heartbeat, sweating, and anxiety. The condition predominantly affects women, especially those between the ages of 30 and 50, but it can also occur in children and older adults. Risk factors include having a family history of thyroid disease, smoking, and having other autoimmune conditions like rheumatoid arthritis, lupus, type 1 diabetes, celiac disease, or vitiligo. Additionally, environmental factors and stress may play a role in triggering the disease in predisposed individuals. Even though Graves's disease is the most common cause of hyperthyroidism, making up 60% to 80% of cases, it remains relatively rare, affecting about 1.2% of people in the United States. How does Graves's disease affect the body? Graves's disease, which causes hyperthyroidism, impacts multiple body systems because thyroid hormones regulate several vital functions. This condition can affect your heart. Rapid heartbeat and other serious heart issues can arise. Skeletal muscles, muscle weakness, and tremors may occur. Eyes. Symptoms can include bulging eyes and sensitivity to light. Skin. The skin may become thin, warm, and moist. Bones. Increased risk of osteoporosis and weakened bones. Liver. Liver function might be influenced, though this is less common. Excess thyroid hormone from Graves's disease speeds up body functions, leading to symptoms such as rapid heartbeat, weight loss, increased appetite, and sweating. It can also cause thyroid eye disease, Graves's ophthalmopathy, characterized by gritty, irritated eyes, swelling, and bulging. In rare cases, it leads to pertibial myxedema, a lumpy, reddish thickening of the skin on the shins. The exact cause of Graves's disease is unknown. It is believed to result from a combination of genetic predisposition and environmental triggers, like stress, viral infections, or pregnancy. The immune system mistakenly attacks the thyroid gland, producing an antibody called thyroid-stimulating immunoglobulin, TSI, that overstimulates thyroid hormone production. To diagnose Graves's disease, your healthcare provider will review your symptoms, medical history, and family history, then perform a physical exam. Diagnostic tests may include thyroid blood tests, measure levels of thyroid hormones and thyroid-stimulating hormone, TSH. Low TSH and high thyroid hormones indicate hyperthyroidism. Thyroid antibody tests. Identify antibodies associated with autoimmune thyroid conditions such as TSI and TBII. Thyroid uptake and scan. Involves ingesting a small amount of radioactive iodine to measure how much is absorbed by the thyroid, indicating Graves's disease if absorption is high. Doppler blood flow measurement. Uses sound waves to detect increased blood flow. How to eat well with Graves's disease. Managing Graves' disease involves paying attention to your diet to support overall health and potentially alleviate symptoms. Foods rich in calcium, selenium, vitamin D, and magnesium can be beneficial, while foods high in iodine might worsen symptoms. Foods to eat. To help manage symptoms, consider including calcium-rich foods, essential for bone health. Non-dairy sources include broccoli, kale, okra, chia seeds, sardines, salmon, soybeans, and tofu. Magnesium-rich foods, important for calcium absorption. Try pumpkin seeds, chia seeds, spinach, almonds, dark chocolate, Brazil nuts, cashews, legumes, avocados, and chicken breast. Selenium-rich foods may support thyroid health and prevent eye complications. Include Brazil nuts, brown rice, sunflower seeds, sardines, tuna, shrimp, and turkey. Foods to avoid or limit gluten. If you have celiac disease, avoid gluten-containing foods such as wheat, rye, barley, and related products. Iodine. Excess iodine might trigger symptoms. Limit foods like iodized salt, fish, oysters, and seaweed. Check medications and multivitamins for iodine content. meat, and animal products. Some studies suggest that vegetarian or plant-based diets might be beneficial. Consider reducing or avoiding beef, chicken, pork, and fish. Consulting with a doctor or dietitian can help tailor your diet to your specific needs and manage your Graves' disease effectively. Graves' disease is a chronic condition, but treatments can help manage thyroid hormone levels and may even lead to periods of remission, where symptoms temporarily improve or disappear. Here are the main treatment options. Beta blockers. Medications like propranolol and metoprolol are often used initially. They help control heart rate and reduce symptoms like anxiety and tremors, but they don't address the root cause of hyperthyroidism or stop thyroid hormone production. Anti-thyroid medications. Drugs such as methimazole, tapazole, registered trademark, and propylthiouracil work by blocking the thyroid gland's hormone production. These medications can cause side effects in a small number of people, including skin rashes, a drop in white blood cells, and rarely, liver disease. Radioiodine therapy. This treatment involves taking a single dose of radioactive iodine, which gradually destroys thyroid cells over a few months. It effectively reduces thyroid hormone levels, but can lead to hypothyroidism, an underactive thyroid, in the future, which is generally easier to manage than hyperthyroidism. This therapy is not suitable for pregnant or breastfeeding women. Surgery. A thyroidectomy involves removing part or all of the thyroid gland. While this can resolve hyperthyroidism, it may lead to hypothyroidism, requiring lifelong thyroid hormone replacement therapy, such as levothyroxine, Synthroid registered trademark. Each treatment has its benefits and risks, and the choice depends on individual circumstances. It's crucial to discuss all available options with your healthcare provider to determine the best approach for managing Graves' disease. Thank you for joining us on this journey through hyperthyroidism and Graves' disease. Understanding and managing these conditions can be complex, but with the right information and support, you can navigate your path to better health with confidence. Remember, every individual's experience with hyperthyroidism and Graves' disease is unique, and personalized care is crucial. Always consult with your healthcare provider to tailor treatments and lifestyle adjustments to your specific needs. Please click on the next video for more Live Good info. Thank you very much.